What are teratogens and how can they affect an unborn fetus or baby? What are some common teratogens and how can you avoid them? Watch this video to find out. Welcome, I'm Maria, and on this channel I explain different child development concepts as well as give you strategies to help you whether you're a parent, educator, or someone who works or cares for young children. In this video, I want to talk about 6 common teratogens and how they can affect a baby's development and give you some ways to avoid or reduce your exposure to them. During pregnancy, it's crucial to be aware of potential teratogens, which are substances or agents that can cause birth defects, abnormalities, or potential harm in a developing fetus. While we'll cover some common teratogens, it's essential to consult your healthcare provider for personalized advice and guidance. Let's start by discussing a few common teratogens and how they can affect your baby's development. First, medications and drugs. Certain medications, both prescription and over-the-counter, can pose risks to your baby. There are many teratogenic medications, so I'm not going to attempt to list them here. If you're taking any over-the-counter medications or even some supplements, read the label before taking them. For example, vitamin A, depending on the dosage, can have a negative effect on the growing fetus. Always inform your healthcare provider about any medications and supplements you are taking or considering during pregnancy. They can provide guidance on safe alternatives or adjust your treatment plan if needed. Second, alcohol and tobacco. Alcohol and tobacco products should be avoided completely during pregnancy. Consuming alcohol during pregnancy can lead to a range of developmental issues such as fetal alcohol spectrum disorders. Smoking tobacco increases the risk of premature birth, low birth weight, and other complications. A third category of teratogens is environmental hazards. Be cautious of exposure to environmental hazards such as certain cleaning products, pesticides, and chemicals. Proper ventilation, wearing protective gear, and reading labels for warnings and precautions can reduce the risk of harmful exposure. Certain pollutants can also fall under this category, such as air pollution or water pollution, so being aware of the level of air pollution in your area can help you stay informed about what steps you can take. Or if you're traveling, be aware of the quality of the tap water. You may need to avoid drinking any form of tap water, including asking for ice cubes. Stick to bottled water or drinks. Another teratogen can be infectious diseases. Certain infections can harm your developing baby. If you know that someone has an infection, you may want to limit your exposure to them. Also, you can discuss with your healthcare provider which vaccines are recommended during pregnancy. It's always important to stay healthy, but especially during pregnancy, as certain infectious diseases can cause harm to the baby. Radiation is another teratogen to be careful about. Radiation exposure, such as from x-rays or certain workplace environments, can potentially harm your baby. Always inform your healthcare provider if you require any medical procedures involving radiation so they can take necessary precautions to protect a developing fetus. And again, be vigilant and aware of signage that alerts you to radiation exposure. And the 6th teratogen I want to mention is stress. This factor may be the most overlooked of all, but can cause much damage to the developing fetus. If a woman is exposed to intense or prolonged stress during pregnancy, excessive levels of cortisol can disrupt the development of the baby's brain. Studies show that these changes in fetal brain development can lead to hypersensitivity to stress later in life, as well as a weakened immune system that can increase vulnerability to disease. High levels of maternal stress during pregnancy can predispose a developing fetus to psychiatric and cardiovascular illnesses decades later. Sometimes we can control the amount of stress we are exposed to, and sometimes we can't. However, a woman can try to control her perspective of the stressor. Studies show that the perception of stress by a pregnant woman can reduce the amount of cortisol, so learning to reduce stress and remaining calm in the midst of stress can lower the effects of cortisol on a growing baby. In addition to types of teratogens, 3 factors that determine whether a specific teratogen will cause harm are the following. Number 1, timing of the exposure. Sometimes a teratogen may do more harm in the embryonic stage or first months of pregnancy than the fetal stage or later months. 2, amount of exposure. If you have one alcoholic drink and then find out you're pregnant and stop, chances are that there will be no harm done to the baby, rather than continuing with drinking alcohol for the rest of pregnancy. And third factor is a developing baby's genetic vulnerability to damage from the agent. Some babies may be more sensitive to harm from certain teratogens because of a genetic predisposition. You may not know this information, so it may be better to avoid any potential teratogens. Remember, knowledge is power, and being informed about teratogens is an important step towards a healthy pregnancy. If you found this information helpful, please give this video a thumbs up and subscribe to my channel for more ways to apply child development concepts. Watch this video next and see you there.